I'm really happy to be here, and today I want to just review with you, to kick off our discussion about communication, the work that we've done and the focus that we do on antimicrobial resistance across the CDC. So I have the pleasure of being able to represent all of the AR work at the CDC through, and it will cover everything. It covers STDs, it covers foodborne enteric illness, it covers zoonotic illness, respiratory infections, healthcare-associated infections. So I'm just going to give you a high-level view of the work that we do. And even in just naming those different sectors at CDC, you can see that we have to work within the One Health perspective as we move through the work that we do every day at CDC. We do have a set definition that we like to share as far as collaboration, transdisciplinary approach, and it is an interconnection between people, animals, plants, and the shared environment. Oops. Okay. So the biggest issue that we look at, one of the biggest issues that we look at CDC is antimicrobial resistance being in the perfect spot for One Health, because we know we need antibiotics for humans, for animals, and for our crops. But we know that anytime antibiotics are used, they can lead to resistance. So this puts us in the perfect realm to be able to work together and collaborate and know how important all of the cross-sectoral work that we do is to be able to move the solution to antimicrobial resistance forward. At the CDC, we work across healthcare, dealing with infection prevention, antimicrobial stewardship. We work with foodborne outbreaks and response, zoonotic outbreaks and response, trying to help with source attribution. We work with our partners at FDA and USDA continuously in that space, detecting, preventing, and tracking and treating drug-resistant pathogens in the community. And this is, again, across everything from methicillin-resistant Staph aureus and skin infections to enteric Shigella transmission, to how does and what role does the environment play in all of this and the impact between humans and animals. And we still have a long way to go in that space. And we also recognize that working domestically is not enough. We also have to work internationally. We travel all over the world. Borders are crossed continuously. We have huge trade, and so domestic and global are just as important as we work forward with antimicrobial resistance. There's a couple things that I'm going to mention today. I don't want to walk through this whole space, but I want to show you, in our perspective at CDC, we've known antimicrobial resistance has been around since antimicrobials, antibiotics came to market. So from the 30s and 40s on, we immediately have started to see antimicrobial resistance in patient treatment. But since 2013 and in 2014 and 15, things really started to become highlighted, and the importance and the spread of antimicrobial resistance and the idea that we are all in this together and we all have a role to play really started moving forward. And I just wanted to mention some drivers, because those drivers continue on with us today in the work that we do. So back in 2013, the CDC put out its first antimicrobial resistance threats report, and that was resistant pathogens that are highly impactful to human health. And again, all those divisions that I mentioned across CDC, what were the ones that were the most illnesses, the most infections, the most deaths? And so we put that report out. I'm mentioning it because we have another one finally coming up to be produced again. In about a month, we will have the CDC AR Threats Report for 2019. So that's one thing that I'll mention again at the end. But when work started to come to light, governments started paying attention and talking. So domestically in the U.S. and internationally across countries, the recognition that antimicrobial resistance was becoming a bigger, scarier problem, with antimicrobials no longer working, resistance factors being identified, knowing that this was an issue, again, across humans, animals, and our environment. So the National Strategy for Combating Antibiotic Resistance came about. President's Council, Advisory Council on Combating Antibiotic Resistance was formed. There was a National Action Plan. It's called CARB, for Combating Antibiotic-Resistant Bacteria. And this, again, was happening in the U.S., but across countries across the world. And so then in 2016, as those documents started forming and guidance was created federal agencies like CDC and FDA and USDA as well started creating their own action plans. What action items, what role do we play? What are the actions that we can do for the next 5 years, starting in 2015 and 2016, can we do to try to combat antibiotic resistance? At that point, the Strategy and Coordination Unit at CDC was formed that started looking across all the divisions, again, pulling the silos across CDC together to say, we all have something in common, antibiotic resistance, how are we going to deal with it? So that was moving forward. The UN, United Nations General Assembly, started talking about antibiotic resistance and actually put it on their agenda in 2016. And then that's when we started looking at commitments. How can we bring people together across healthcare, across industry, environment, to make commitments from the space that they're in? Industry, private sector, academia, professional organizations, government agencies, to say, what role can we play to try to combat and change the resistance, the spread and the transmission and the creation of antibiotic resistance? So it brings us to where we are today, still working in this space. So we know that we need antibiotics, and we know that we have not seen a lot of antibiotics come to market. So everyone talks about how much we need to move them forward, and that is a fact. We need more antibiotics that will work and will last and will take over as we lose some of the antibiotics we currently have. But it's not the only solution. There are so many things, and many of you already know this. It's the space you're working in. It's the change that you're already making. Tracking data, infection control, biosecurity, watching stewardship and optimizing antibiotic use, environment and sanitation, and then vaccines, therapeutics, and diagnostics all play an important role. I'm only going to mention this once because I'm going to stay on the domestic side, but we do work CDC internationally, and these are the groups that we're working with. World Health Organization, Food and Agriculture Organization, World Organization for Animal Health, and multiple other international organizations as, again, we look at antimicrobial resistance across the One Health sector, so including human health, animal health, and the environment. So back to the AMR challenge. When I talked about those commitments, gathering commitments to see how can we all come together for one focus on how can we combat antibiotic resistance and how can we move it forward from the space that we're all in. So the AMR challenge was put forward from CDC and other groups like Wellcome Trust and different organizations. Last year it was a kickoff, again, because we knew that the United Nations was going to be discussing antibiotic resistance. And so the idea of commitment collection again came up. So we did it once in 2015. Many individuals came together, made commitments, and made good changes and strides over the 5 years. So last year, we reached out again with our partners and said, how can we come together again and what commitments can be made? So we had the AMR challenge over the course of the year collecting those commitments, and the event that sort of culminated in those commitments and promises and looks of the work that people want to do over the next 5 years. So another new 5-year cycle to say how can we deal with the spread and the creation and the pressure and selective pressure of antibiotic resistance. So that's one thing if you're interested. I know many of you here, NIAA was a great supporter and put forward a commitment to the AMR challenge, as did many of you here in the space that you're in and the groups that you represent. So we appreciate all of that and the work that you've done in the previous 5 years and now that you've committed to and promised for the next 5 years. So at CDC, part of communicating all that work is for us to get that on the website and to show what commitments have been made by which organizations and the success in the movement forward in that. So we hope to track that over the next 5 years to be able to update that work so that we can see the movement forward. Well, sometimes it works, sometimes it doesn't. So of all of the commitments that were made, and there were over 350 commitments made, there were 47 plus major food and agriculture related food corporations, organizations committing to reduce and prevent the spread of antimicrobial resistance in animals in food production. So again, that's a huge, great group that committed out of all of the commitments that were made. And again, those can be found on the CDC website. So we hope to continue to follow up with you to be able to post progress and to be able to communicate the work that's being done and the successes that are made. The next thing I want to talk about is the National Action Plan. So we had National Action Plan for the last 5 years, and we are now working on the next 5 years. Sorry, there was one. It's coming back. There we go. Oh my goodness. Sorry, I want to go forward. Right there. Okay, so the CARB National Action Plan and strategy to move this work forward is about slowing the emergence of resistant bacteria, strengthening national One Health surveillance. And One Health, again, huge focus across all sectors, not just one. Advancing development of innovative diagnostic tests, accelerating applied research development for new antibiotics, therapeutics, and vaccines. And again, then that international collaboration and capacities. So those high goals cover all of the work that we're all in the work that we need to move forward. Those will be the same goals for the next 5 years, but new action items. What have we accomplished and what do we need to move for the next 5 years? So right now, CDC is working with all of the federal agencies to look at the work that we have accomplished and those action items to say, what do we plan to do for the next 5 years? And when that is all organized and cohesive, it will be put forward so that individuals can go look at that National Action Plan and the work that we intend to do underneath it. The other thing I want to talk about is the Antibiotic Resistance Solutions Initiative. It's the work as a cohesive group that we do under AR at the CDC. So just a couple of the areas and the spaces that we work in. Money that comes into CDC doesn't all stay at CDC. It goes out the door to partners to strengthen the work that we do in public health. So each year right now through the last 5-year CARB National Action Plan, the CDC would get about $170 million, again, to put and support the work that we do inside CDC as well as work with our partners. So I'll just walk through some of that. A big chunk of that money goes out the door to state and local health departments because we are public health. We have very close connection with all of the health departments within the states. And again, part of communicating that information and knowing where those dollars go and what the states do with it is where we show on the CDC website through one of our EPI and lab capacity grants, cooperative agreements, is how we get a lot of our money to the state health departments. And so what we've done is you can go to this AR Investments Map, you can click on a state, and there'll be an entire 1 or 2, 3 pages that come up by state to show what that state does as far as combating antibiotic resistance with the money that we've given them. And again, it's work in healthcare, it's work in foodborne illness and response, it's work in zoonotic outbreaks and collecting questions and dealing with gathering patient information and tracking that distribution, trying to come up with source attribution to solve and stop the outbreaks and the human illness. There's other groups that we have and other ways that we put out money to states and other organizations as well. One is our broad agency announcement, and this is the big amount of money that we put out for individual research. So this is probably the best way that we would be able to collaborate with any of you if you have ideas for projects or if you see a broad agency announcement go out. Right now it goes out once a year. I think it will go out next year because of the threats report and the CARB National Action Plan. There'll be a little break this year, but next fall, if you watch for the broad agency announcement from CDC, what it is questions and posed projects that we at CDC realize there's a gap or there's an issue that we're looking for a solution. So we can put out topic areas and pose issues and look for groups to respond to that with a proposal to offer some research work for a solution. And so that money goes out to educational institutions, nonprofit organizations, state and local government, private industry. Again, it's research and development that we cannot do at the CDC that we can do through partners. So through these BAAs, it's another way that we are able to get some of the dollars that we have out the door to broaden the reach and the stretch that we have for dealing with antibiotic resistance. The next thing that we have is the Antibiotic Resistance Laboratory Network, and this is huge. I have the sample up here, and it's actually older. It shows you the 7 regional labs that we have, some of the work that they do on Neisseria gonorrhea. We have a specific TB area group. We have Candida auris being tested at these, and there's actually a change coming up between Texas and Utah. So, but the idea is that we have we have labs at the CDC that do work. We have regional labs that collect specimens and do work. Then we have all of the labs in the state health departments that do the work that they do. And again, they're doing work on healthcare-associated infection pathogens. They're doing work on enteric illnesses, zoonotic illnesses, mycotics, fungal infections like Candida auris and other candidemias, and Neisseria gonorrhea and respiratory illness. So again, that whole swath of work that's across antimicrobial resistance is happening throughout all of the state health departments and all the way up the chain through the work at the CDC. And then finally, just to know, we have an isolate bank. So with all of the pathogens that are collected and the specimens that are collected to identify what we have, what we're dealing with, what is the pathogen, what is the resistance pattern, how can it be best treated, we save many of those isolates to create a bank so that researchers, diagnostic groups, academic institutions can actually request a panel of isolates from us that they can use to do their testing that they need to do. So we continue to grow these the isolate bank so that we have isolates available when people do want to test a new drug or a new diagnostic. So we make that available as well. And we actually do that in concert with FDA. So they're all part of this isolate bank as well. Again, I mentioned the threats report, and I would love if you would go look at it when it comes out. We expect it out hopefully before the end of November. It will be posted on the CDC website. It is the 2019 CDC AR Threats Report. You will see, again, pathogens across all human illness, the scariest ones that are causing the biggest threat as far as antibiotic resistance right now and what we're doing to deal with it. We have infographics, I think, in there that we've improved on, again, touching on all the importance of communication, showing the importance of One Health and that interconnection between human, animals, and the environment. So we would encourage you to take a look at it so that you can see directly the space and the work that we do in AR at CDC, and would love your feedback on it. So if you have feedback, if you have thoughts, we would appreciate that. With the release of the threats report, there's also other things that we want to do, and that is updating our website. And this is another thing that I want to take away from the meeting today, is that CDC has a lot of information to communicate, and I know that we do some of that communication very well, and I know that we can probably improve on a lot of that communication. And I know that there's things that are missing in there. And some of the things that have come into focus as we've been working on the threats report is it's very easy for us to work in the human space and then talk about healthcare and talk to healthcare providers, because that's the space we are working in most strongly every day. But we know that we have enteric illness and we have zoonotic illness and we have fungal infections, and that opens the door to who else do we talk to, and again, under this One Health space. So we want to talk to veterinarians. We want to talk to industry. We want to talk to animal ag industry. And so we need your help and your ideas on what you want to hear from us. What would you like a web page to look like? What would you want to see if you could go into the website and easily get to links across CDC? As far as antimicrobial resistance, what would you want to see? Where would you want to easily find? It's big, and we know jumping around the website is very difficult. So how can we make it easy for you to get what you need out of it and get it pretty quickly? We've got the National Antibiotic Resistance Monitoring System, and it's CDC and FDA and USDA, our NARMS, which tracks enteric illness in humans, and then retail meats and animal at slaughter. So we've got a lot of data there. I'm not sure how many people look at it. Would it be helpful? Would it be an easy, if we got you the link and you could get to it, if we could build alerts, would you be interested in seeing specific pathogens that are making humans sick, or pathogens that, are animals found in retail meat or at slaughter? and those pathogens and what the resistance patterns look like. How easy can we make it for you to have and find use out of the CDC website? So that's what I'm looking at for us here so that we can move things forward. We want to make sure infographics are helpful. We want to be able to, again, create those pages for veterinarians and animal industry that would be useful. We don't want to do it if it's not needed or not wanted, but if we do it, we want to do it right. So we're looking for your input on that. Finally, the U.S. Antibiotic Awareness Week is coming up. November, it's the week before the week of Thanksgiving. It will hopefully be right around the threats report, so there's going to be a lot of movement forward on that. Again, our websites won't be exactly where we want them to be. It's going to be a growth movement after Antibiotic Awareness Week and the threats report comes out this year. But again, we hope to make a lot of movement and improvement forward, and we need your input to do that. So with that, I'll stop and thank you.